research project correlating non-small cell lung cancer ALK resistance mutations to ALK inhibitor responses. Lung cancer is a disease of cells that starts in cells of the lungs. In addition to being one of the most common types of cancer, lung cancer is also the leading cause of cancer deaths in the United States in 2017, as shown in this bar graph on the right, accounting for approximately 25% of deaths in the United States. Developed from spontaneous mutations in ALK such that it is less effective in treating non-small cell lung cancer. Alectinib, as shown on the right, is a second-generation tyrosine kinase inhibitor that is able to inhibit secondary resistance mutations found in non-small cell lung cancer patients treated with crizotinib. However, there's still an urgent need to develop new ALK inhibitors due to emerging resistance to alectinib and other ALK inhibitors in the clinic. Therefore, the objective of this project is to correlate non-small cell lung cancer ALK resistance mutations to crizotinib and alectinib drug responses. cBioportal, COSMIC, and CellMiner CDB are the online databases used in this project. These results show that ALK resistance mutations are located in the intracellular protein tyrosine kinase domain or the extracellular glycine-rich domain of the ALK gene. Therefore, we can conclude that the previously unidentified ALK Y262H and S289Y mutations in the H322M cell line may confer resistance to both crizotinib and alectinib by causing constitutive activation and overexpression of ALK and subsequently non-small cell lung cancer initiation and progression despite ALK inhibition by these drugs. Furthermore, structural mapping of ALK resistance mutations indicates that they are located in the intracellular protein tyrosine kinase domain or the extracellular glycine-rich domain of the ALK gene. These findings can then be used to develop ALK-targeted therapies to mitigate resistance to crizotinib and alectinib in non-small cell lung cancer patients.
My project investigated microsatellite's ability as a prognostic factor in stage 2 colorectal cancer. So throughout this presentation, because I'm using a poster and not a slideshow talking about, so let's start with my objective and hypothesis. The objective of this study was to identify novel biomarkers. The biomarker that we investigated was microsatellite instability or MSI in order to predict and improve colorectal cancer prognosis and identify adequate therapy for specific patients. And the question we investigated was if microsatellite instability occurs alongside commonly mutated genes, then it can be used as a prognostic factor. Is that the majority of MSI occurs during the early stage primary because MSI occurs alongside ATM mutations, and ATM mutations occur primarily in the early stage primary. So we made several conclusions throughout this study. Most prevalently, that MSI and ATM mutations exhibit mutual occurrence and that they both appear early together in cancer progression. And this gives us a new dimension through which we can predict colorectal cancer. And we also realized that APC and TP53 don't exhibit a similar correlation with ATM as ATM mutation does with MSI. And we believe this is because APC isn't associated with the MMR pathway. And we believe TP53 didn't show the trend for two reasons. First, because TP53 occurs downstream of ATM in the MMR pathway. And second, that data has shown that TP53 mutations and ATM mutations are mutually exclusive. So why are these findings relevant to the biomedical and biotechnological world? So first, it is very important because MSI is relatively easy to observe and can be observed through standard lab procedures such as polymerase chain reaction and immunohistochemical staining. So not only does this determine if someone is predisposed to cancer, it also can determine if a certain familial line is predisposed to cancer, because if someone has a germline mutation in a gene that causes MSI, then this mutation can be passed down to their offspring.
My presentation is on the relationship between the gene BRCA2 and the effects it has on prostate cancer. This is my table of contents, and I'll be discussing my project in this order. Prostate cancer is one of the most common cancers affecting men, especially when they become older. About 1 out of 9 of all men will be diagnosed with prostate cancer during their lifetime. It is more prevalent in men of African descent, and certain chemical carcinogens may also trigger this cancer. The chart on the left shows the percentage of patients with BRCA2 mutations or copy number alteration, CNA, in relation to their Gleason score after a radical prostatectomy. This data came from the Nature Genetics database in CBio portal, and it's found that there is a higher percentage of patients with BRCA2 mutations or CNA in the group with higher Gleason scores. 3% of the patients with Gleason scores of 8 or higher in this database have BRCA2 mutations, compared to less than 1.5% for the Gleason score of 7. This shows that BRCA2 alteration is correlated with a negative patient outcome after a radical prostatectomy, which is a surgical operation where the prostate and its surrounding tissue are completely removed.
This was an excellent presentation. And could you comment on the relationship of the predictive power comparing, say, BRCA mutations to PSA for diagnostics?
Could you repeat the last part, please?
So I saw that you mentioned that PSA is usually a diagnostic method. I was wondering if you could use BRCA mutations as a potential signal of prostate cancer in comparison to PSA.
Well, I believe that that could be an interesting idea to look at, but so far I don't know how effective that will be, because with it, because I'm going to go to this slide. Because, for example, in this data, while the all BRCA2 mutations is a lot more common than it is a lot more common in metastatic cancer than it is in local regional cancer. Overall, the percentage of cases that have the gene alteration is not that large, especially when you have local regional cancer. Only 3.3% of the gene is altered. So while that could be interesting to look at, I don't think it could be used alongside PSA as a more reliable marker. However, I have found that for BRCA2 mutation is associated with poor PSA reduction in certain chemotherapy treatments.
Excellent. Thank you so much for answering. Great job.
You gave a very nice talk. I was just wondering, I know you said in the beginning that you picked ATM, P53, and APC because they're highly mutated. But, I mean, there are so many genes in the MMR pathway which are mutated. It would be useful to look into not all, but some of the genes, because MSI is a very hot topic right now. And there are multiple genes which are published and coming up that can be looked more into, and especially the way you are doing, I think it could be really great.
Okay, thank you for
Once a
feedback. That's
gene is
definitely
like
a next step I
Werner,
could take.
yeah,
Sorry.